First question is, where do you stand on mental health issues for our state? Describe the primary problems you see and the solutions you would offer for improving mental health care for North Carolina. First, Pat Smathers.
Thank you, Jerry. I don't think there's any question that our mental health system is in crisis in this state and is going to have to be addressed. There's a lot of ways that we can go about addressing it. I believe that the state was right in trying to do a community-based effort in addressing our mental health problems. The problem is it wasn't funded, and that's the first thing. We've got to fund mental health, and it needs to be a part of our overall health care plan in this state. Second thing, we need to listen to the healthcare professionals. They know what is out there, and we need to pay attention to what they have to say. We need to remove the stigma of mental health and the failure of people to recognize the importance of mental health. You know, I know from the practice of law in dealing with the criminal courts and the family courts and the civil courts that the vast majority of the issues we deal with really do affect are caused by emotional and mental problems. I have no problem in saying that, and we need to address that. We need to remove the stigma. It makes no sense to me that someone can have the flu and there's no one questions going to the doctor to be treated for the flu. But someone can have a mental illness or an emotional problem that they not only would harm themselves, but harm others. But yet we place a stigma on that and seeking that kind of treatment. We've got to address that issue and as a society and say there's nothing wrong. If you have a sickness or an illness, let's address it and be honest about it. We have to do it with a sense of urgency and compassion. Mental illness is not something to push aside. And I know from talking to people here in this city and other cities that the problems that we're having with mental illness are falling over into our churches, into areas, our mental illness folks. People with mental illnesses are becoming a burden for the towns and the cities. And unfortunately, so many of them are returning veterans from the war and prior military veteran people, which greatly concern me as being a veteran myself. So, to sum it up, it is a crisis. It's a high priority. It has to be addressed. It's got to be funded. We've got to do it with urgency and compassion. We've got to do it in the right way, in the democratic way. Thank you.
I was hoping this question would come up, but it's a heck of a question to answer in 2 minutes. As a local elected official here in Winston-Salem, one of the things that I've been dealing with for a while now is the problem of homelessness, particularly chronic homelessness. People on our streets, they have no place to go. They often have no ability to support themselves in permanent housing when they find it, and they end up back on the streets. It's a cycle. What I didn't realize until I started studying the problems in our mental health care system was that those two problems are directly related. A few years ago, North Carolina began a policy of deinstitutionalization and privatization of mental health care. It was well intended. The problem was the way in which it's being carried out has resulted in a catastrophe for the system. What we have now is a very spotty coverage, both in terms of the services that are available and in the geographic provision of those services around the state. We have a broken payment processing system and eligibility screening system. You know, now we have a fourth-party screener for mental health care eligibility payments. They're not even based in North Carolina. You hear that from folks that are professionals working to provide this care. What we need to do is we need to have a statewide plan which addresses all those issues, which ensures that we have a plan for the continuity of care that will provide supportive services for people dealing with chronic mental health care problems, with chronic addiction problems, and help them stay in housing, for example, when they get it, and help them get it. We need to ensure that the services for community-based care are provided, that the networks are in place before we continue with de-emphasizing the institutions that we have, although that's a goal we should provide. And we're going to have to put more money into the system. North Carolina is one of the lowest per capita providers for health care in the country.
For those of you who've been to Raleigh in the last year or so, you've seen likely these Dix 306 signs, which refers to preserving the Dorothea Dix State Psychiatric Hospital as open space. 6 months ago, I came up with my own sign. Dorothea, 365. Dorothea Dix was an incredible North Carolina advocate for mental health. And I think while we need to preserve open space, we need a 365-day, year-round commitment to mental health. We have got to make this work, and there are a lot of pieces that aren't working. First, the psychiatric hospitals. That we can't close Dix till we have the services available for any North Carolinian who needs them. Second, community care. And let me say again on the hospitals, there's got to be accountability. These are important positions, these are high-profile positions, these are well-paid positions, and we must insist that those operating our psychiatric hospitals are of the highest quality and are getting results and providing the services. Community care, Pat's exactly right. There has to be more money in the system. We did privatization with no consideration of whether the service providers were going to be willing and able to exist as a business. Even the nonprofit service providers are getting out of it. And what I would say, what I'll tell the legislature and what I'll tell the governor is, just like in education, just like with our prison system, if we don't put more funding in, the courts are going to take over our mental health care system. We've got to bring the local hospitals to the table. They've got to provide necessary beds. The insurance companies have to do more. And it's not just mental health, it's developmental disabilities and it's substance abuse. And the mental health parity bill was a first step, but it was a baby step. And we've got to include the child illnesses and substance abuse in mental health parity.